Last week, we had Dr. Davina Longshore, Executive Director of the Cummings Foundation for Behavioral Health, on our newscast to talk about the Foundation's commitment to law enforcement officers' health and well-being. Today, we dive deeper into the research and some of the help available here in our area. We want to welcome back Dr. Longshore and Ethan Updahl with Specialty Health Wellness and Prevention Programs. Thanks so much for coming in.
Thank you for having us.
Well, first of all, can you talk about the Cummings Foundation for Behavioral Health, why it's so committed to our law enforcement? And I think it goes back to your founder's interest in the convergence of physical and mental health.
So yes, our founder was Dr. Nicholas Cummings, very well known within the psychological community. He's a prior president of the American Psychological Association, and he developed an integrated managed care model that one of our biggest pharmaceutical companies in the United States uses. And where some of his research began with this particular community was actually in World War II, where he studied things like fear and its impact on soldiers and how they performed in the war. He also studied the impact of the war on the psychological and mental health well-being of soldiers. And so at Cummings, we're just continuing the work of our founder, especially in a time where there's so much unrest dealing with the law enforcement community. The Cummings Foundation wanted to be an answer to some of the issues that we see that law enforcement officers are facing and how that impacts our greater community.
And the Cummings Foundation for Behavioral Health develops programs to help in this mission. Can you talk about your experience that's helped you come up with these strategies?
Yes, of course. So I have a doctorate in clinical psychology with a specialization in military, criminal, and police psychology. And so some of the things that you learn as a psychologist in your educational program is human development over a lifespan, and how biology, how external factors impact how we see the world and how we interact with the world throughout our lives. And then now my specialty is in police and criminal and military psychology. And so with that specialty, what I'm able to look at is how the environment and the stressors that officers go through in their job, how this now converges with the things they experience in their personal lives, with their backgrounds, and how it impacts their job performance, and then of course how it impacts the community.
And another priority of your organization is reducing the stigma of getting mental health support. How important is that?
It is very important, because if you don't address the stigma, you can provide the resources and the officers won't use them. I believe that when people think of mental health, they think of severe mental illness like schizophrenia, but they don't think about we're humans having a human experience. We all have emotions, and that there's things that we experience every day that need to be addressed with someone who understands how you're being impacted by those things. And within the law enforcement community, one of the things that we're trying to do with our programming is let officers know, yes, you save people, you help the community, but we all need help. It doesn't make you weak saying, I need help. I'm stressed out, I'm not sleeping. Can someone help me with this?
And it makes them relatable too.
Yes, yes, exactly.
You know, we can all identify with that. Your nonprofit also works with organizations that provide services, and we have some of those services available here in Reno.
That's correct, that's correct. I'll let Ethan from Specialty Health talk to you more about that.
Yeah, so Specialty Health has been working with law enforcement communities for about 20 years. Our wellness programs include advanced laboratory testing, diet, exercise, sleep, and stress management. But those interventions are based specifically on proprietary health questionnaires that we've developed and lab panels that are exclusive to us, so that we can give better recommendations for those law enforcement officers who are dealing with unique scenarios, whether it be shift work, whether it be the exposure to trauma, you know, things of that nature.
And that's accessible through the Cummings Foundation for Behavioral Health?
Yeah, the Cummings Foundation has taken us, you know, nationally now, and we've drawn lab work and followed up with our nutrition recommendations with the populations and the research that they're running throughout the country.
How vital are these services?
We see the services as probably the first line of defense. The cardiometabolic factors that we look at predate all of the mental health issues and depression and other things that we're seeing with these law enforcement officers.
When we take care of our law enforcement officers, that's a community issue because it impacts our entire community.
That's correct. I don't think people realize how important it is that our officers, one, have sleep. You can't make good decisions in a life or death situation if you're not getting adequate sleep, because your brain won't process the situation correctly. If they're arguing at home with their spouses, if they're disconnected socially from people and not getting emotional support, if they're not laughing within their daily lives, they won't be able to do their job effectively because, one, they won't have the energy to do it. Two, it distorts their perception. And so their perception of the community is changed. Therefore, their interaction in certain situations may not necessarily be as adequate as it should be.
Can you talk about what we can do here to help?
Yes, people can donate. While right now the Cummings Foundation is only running off of funds that have been donated by the Cummings family themselves, it takes us millions of dollars to provide all these services to the different organizations, and it is our desire that every organization can have a mental health and wellness program to support the well-being of their officers. So people can visit our website at cummingscfbh.org, and up in the right-hand top corner, they can click donate. Every little bit helps.
Taking care of our own.
Yes.
Thanks so much for coming in. We can get more information on the Cummings Foundation for Behavioral Health, its programs, and how you can support its mission and bring more resources here at cummingscfbh.org.